Okay, so the last speaker of today's session is Professor Shigeru Hirano.
Yes.
Yes, please.
Okay, this is our last talk. Oxidative stress and the human voice. This has been just published in the International Journal of Medical Sciences by the guest editor, Professor Inufusa. I'd like to pick up some topics from here. Oxidative stress is caused by reactive oxygen species of free radicals. They are similar but a little bit different. But anyway, they damage the tissues and it causes aging, cancer, many diseases, and it actually accumulates with age. So we have to do something. But we have antioxidant system inside our body, such as superoxide dismutase or catalase. And we also can take vitamin C or E or other ingredients to suppress the oxidative stress. Voice is created by the power of the respiratory system, which vibrates the vocal mucosa, and then resonance makes the individual quality of a voice. So this system is very important, but they are deteriorated with age or other diseases. Vocal is kind of string of the guitar. It has a wide range of the pitch. This is a male vocal from low pitch to high pitch. The vocal becomes a lantern in a high pitch formation, and then go down to the shortened portion by low pitch formation. This is a very unique function of this mucosa. This is only the mucosa that vibrates like this. And these tissues can be deteriorated with many causes, like vocal abuse in cases of the singers or the professional voice users, inflammation like COVID-19, inhalation of cigarette, reflux, heat, surgery, and aging. So we have to do something to prevent these pathological changes. I'd like to talk about role of antioxidant for voice in terms of the anti-aging strategy or maintenance or protection of a voice for some patients with vocal abuse or vocal wound. Now, talking about age-related changes of dysphonia and dysphagia, it occurs around the age of 50 years old. And first of all, vocal atrophy occurs, which causes dysphonia. And then it's followed by dysphagia, caused by sensory or muscular deficit of swallowing-related muscles or sensory functions. So we have to stop the age-related deficit of these systems at the age of around 50 years old. Callas is the best soprano singer in the 20th century, but it was said that she always suffered from her aging voice, and then she tried calorie restriction to keep her voice in whole life, and she dies at the age of 54. Please click the right side of video, John. Right side. This is a singing voice at the age of 30. Can you click? Mm-hmm. Oh, no, the other side. Stop it. Stop. Can't stop. And click the other one. This is a singing voice at the age of 50s. Okay, thank you. Any difference? There is a difference. But her singing voice is still good at the age of 50s. But she suffered from aging of her voice. This is a histology of the vocal fold, which includes layered structure, including vocal ligament and rich hyaluronic acids. They are essential for the vibration of the vocal fold. Aging changes the histology of the vocal fold. This is a 90 years old man. The mucosa becomes thinner and fibrotic changes are prominent, which makes the vocal fold atrophy and the heart vibrate. Can you run the video? So the voice is very bad. Thank you. And this is the rat model of aging of the vocal fold, and we found that hyaluronic acid is gradually decreased with age, and the fibrosis gradually proceed with age. So we need to stop this histological aging changes. And another thing is aging of the vocal fold is a woman. A woman shows a different change with age on the voice. Their voice becomes a lower pitch and becomes rough with age after menopause. So edematous change occurs actually after menopause. So their vocal fold becomes atrophied, but the edematous change occurs, and finally their voice becomes lower and rough. Can you run the video? So her voice has edematous change, lower pitch, and rough. Cells in the vocal fold varies, but the most predominant cells are fibroblasts, which actually produce every extracellular matrix or growth factors as well. And these cells is also aged. Normal condition, they have a lot of endoplasmic organella that produces proteins of extracellular matrix, and also they have vitamin A inside the plasma. But with aged, fibroblast shows less organella, less vitamin A, and they show dysfunction. Gene expression in the rat vocal folds also shows a downregulation of hyaluronic acid synthase, procollagen, or MMP as well. So every function is down with age. We found accumulation of ROS in the aged rat vocal folds. And so there are many age-related negative effects. But the critical part is the ROS that damages the cells with age, and that causes deterioration of the function of extracellular matrix production or growth factors function. Now, for maintenance of the vocal fold with age, we recommend 4 things. One is vocal hygiene, that means control of acid reflux or control of airway allergy. A second, hydration, drink water more than 1.5 liters per day to moisture the vocal fold. And voice training or voice therapy should be good. And antioxidant is very important. We fed young rats with antioxidant 1 year until they get old. In this time, we used astaxanthin as the antioxidant, and we check what happens. In old rats, there are many ROS accumulation, but antioxidant group shows much few ROS accumulation. And also, hyaluronic acid shows decrease in old rats, but it's much better in the antioxidant treatment groups. So antioxidants can maintain the vocal against age. This is anti-aging strategy. And maintenance of protection of voice should focus on the vocal abuse, injury of the vocal folds, and if the vocal fold is injured, the ROS briefly accumulates during the very early phase of the inflammation, wound healing. So we have 3 studies. I'd like to show you the results of the 3 studies about maintenance of protection of voice. And the first study was vocal load study. In this clinical study, 10 healthy men were forced to voice with a loud voice like 80 decibel for 1 hour. This is a very, very hard task, and the voice becomes rough just after the loading. So we check what happens after taking antioxidant astaxanthin in the series. And this is 28 years old male, very healthy male. And this shows the phonatory function, and red parts shows hoarseness, bad voice. So before the loading, everything is normal. And immediately after the vocal load, everything becomes red. And then 30 minutes later, it recovers. If it doesn't recover, the study is very problematic. But this is the study design. And after antioxidant, nothing happens, even after the vocal loading. 28 years male. John, can you click the pre-image? Okay, this is normal.
Hi.
And click the right upper one. Immediately, the voice becomes rough. High-pitched phonation is impossible. And click the other one. This is after antioxidant. The voice is clear. High-pitched phonation is possible. So there's no damage by the vocal loading if you take the antioxidant. So antioxidant maintains voice even though you speak a lot. The second study is a Kampo study. Kampo is the natural Japanese medicine, and Kyosei Hatekigan is commercially available. This includes 9 ingredients, and this is indicated for cold, acute laryngitis. But the mechanism is not clear. It is said that this has anti-inflammation or antioxidant effects, but there is no data or no evidence forever. And so far. And so we did a study with a rat vocal fold injury model. The rat vocal fold was injured, and then this compound was applied before and after the surgery. Campo shows reduction of cell infiltration during 1 day to 3 days as compared to the sham without Campo. And Campo reduced ROS at day 3 as compared to the sham. And Campo preserved hyaluronic acid at day 56 by preserving the hyaluronic acid and reducing the fibrosis. So, and also, Campo downregulated the gene expression of inflammatory gene or fibrotic gene as compared to sham. So we confirmed that Campo medicine can be available as the anti-inflammatory or antioxidant therapy in case of the acute inflammation of the vocal fold. And finally, we did Twendee X projects named the maintenance of singing voice. The subjects were professional opera singers. 26 people were involved. They have Japanese singers and Bulgarian singers. Mean age was 51 years old. Twendee X was applied for 1 month, and we check what happens on the singing voice handicap index. Singing voice handicap index consists of 10 questionnaires which represent the handicap of singing voice. For example, it takes a lot of effort to sing. I'm unsure what will come when we sing or others. So higher score shows higher handicap of singing voice. And the results, singing voice handicap index was significantly improved by application of the Twendee X in both groups of Japanese group or Bulgarian groups. And there was somehow significant difference in the baseline of singing voice handicap index between Japanese groups and Bulgarian groups. But the degree of the improvement has no difference between the groups. So Twendee X works for protecting singing voice regardless of the baseline. There was no correlation between age and singing voice handicap index in total subjects, but that degree of improvement of singing voice handicap index was more appropriate, more prominent in younger generations. So it's recommended to take Twendee X from young. Symptoms improved are efforts of singing or vocal fatigue during singing, cannot maintain singing. So Twendee X is effective to continue singing. So in conclusion, ROS, oxidative stress affects aging and damage of voice. Antioxidant is significantly useful for anti-aging and protection of voice. It is recommended to take Twendee X during vocal abuse or singing since you are young. So thank you for your attention.
Thank you very much for that nice presentation, Professor Hirano. Is there any comment or questions from the floor? Okay, thank you very much.
Thank you so much.